I think the Minister Hunt is on the, yes, there he is on the television.
Oh.
Thanks, Minister.
That's right. Good morning, Paul, and good morning, everybody. I'm delighted to be joined today by the Chief Medical Officer, Professor Paul Kelly, and we're here to both update on the booster program and update on the implementation and bringing forward boosters to 4 months from the 4th of January on the basis of ATAGI advice, and to 3 months on the 31st of January, also following that advice. If I may, I'll indicate briefly an update on the program and then turn to Professor Kelly. In terms of the program, we've had 192,000 doses yesterday, so on the edge of Christmas. Australians have been coming forward, and I really want to thank them for that. And that includes 148,000 boosters yesterday. About 10 a.m. this morning, we will pass the 2 million booster mark. That's 500,000 ahead of schedule at this point in time. So Australians have been really fantastic in coming forward, and I want to thank them for that in particular. The second thing is that that will mean we've had about 1.3 million doses since the expansion of eligibility from 6 months to 5 months, just over a week and a half ago. And so that's really seen very high rates of vaccination. In fact, we're now at 42 million doses. We have passed 42 million doses, and all up, that means that we now have 94.1% first and 91% second. And at this point in time, as I say, this morning we'll pass the 2 million dose mark for boosters. So on all three fronts, Australians are exceeding expectations, and that's just a great tribute to our health workers, our medical workers, but above all else to all of those Australians who've come forward through all of the different channels, Commonwealth clinics, state clinics, GPs, and pharmacies and Indigenous clinics. So thank you to everybody. In particular, I would note that as we've foreshadowed, ATAGI has been going through the constant review process of the international evidence, and Professor Kelly will speak to that. And on the basis of advice of the Australian Technical Advisory Group on Immunisation, it's no surprise we will be bringing forward the eligibility for the booster dose to 4 months as of the 4th of January. The planning behind that is that will open up a new cohort. Currently, that means that we will go from about 3.2 million people who are eligible today to approximately 7.5 million who will be eligible as of the 4th of January. And that means that the cohort is expanded. It will be expanded again on the 31st of January to 3 months, and that will take it out to 16 million Australians who will be eligible at that point in time. And as we've said all along, eligibility is the beginning of access. It doesn't mean that somebody's overdue the very day they become eligible. These dates have been set out of an abundance of caution to give Australians early continued protection. And the advice we have is that the protection as it is very strong against severe illness, but what we'll see is a much stronger protection against transmission. And Professor Kelly, again, will set that out in more detail. The last element that I want to refer to, which follows the ATAGI advice, is that jurisdictions who believe that they have the capacity to bring forward any of these dates without displacing older and more eligible people in terms of those that have had a longer period between their second dose and the access to boosters should feel free to do so. As an example, I was speaking with the Premier of South Australia last night. He believes that they have very strong capacity, and so ATAGI has given jurisdictions freedom to move forward with their state clinics prior to then if they have that capacity without displacing. And this is a very important principle, that the staged progressive program as quickly as possible is what we've focused on, but focusing on the priority populations of the further someone has been from their second dose, the more important it is that they're vaccinated. By acting at 4 months and then progressively at 3 months, we're giving the highest priority to those who have the greatest distance in time from having been vaccinated. And this also follows the age cohort because of the way in which the primary courses were delivered. So it's protecting the oldest and the immunocompromised and giving them priority as is appropriate. So I really want to thank ATAGI for their tireless work, the TGA, the Therapeutic Goods Administration, the Scientific and Technical Advisory Group, which has been led by Professor Murphy. So all of those groups have contributed to giving the government the ability to make this decision off the basis, on the back of what I believe is the strongest medical advice in the world. The last thing I want to do is to announce that the Council of Elders, 14 members, has been released today. The chair is Ian Yates, a very distinguished Australian head of Council of the Ageing, and there are, amongst those 14 members, 5 males, 9 females. We have really strong female representation, very strong Indigenous representation, including, of course, Dr. Miriam Rose Ungamir Bauman, the Senior Australian of the Year, Professor Tom Karma, then other distinguished Australians such as Dr. Kay Patterson, former Health Minister, but also the Age Discrimination Commissioner, and Daniela Hiss, who is a leading author and academic and practitioner in relation to dementia care and management. So a really fine group of older Australians who stepped forward, and we're very blessed to be able to have their support and capability. Lastly, I want to wish everybody a strong Christmas. These are always challenging times, but when we look at this year, we have one of the lowest rates of loss of life in the world. We have one of the highest vaccination rates, and it continues to climb. 94.1% first doses, 91% second doses, and we've had one of the strongest economic recoveries with employment above what it was prior to the pandemic. So thank you to all Australians. Please keep coming forward for your boosters, and if you haven't had your first or second dose yet, it's more important than ever to have those doses. Professor Kelly?
Thank you, Minister. I might start with that point. So this is about the change in the booster program advice from ATAGI, but a real call out to anyone in Australia who is currently eligible for their primary doses, those first 2 doses, that this is still the most important component of protection. We've seen a rise in intensive care patients in New South Wales in recent days. Almost all of those have been unvaccinated, not even a first dose, let alone a booster. So that still remains the number one priority for the vaccination program. The changes today, as announced by the Minister on the basis of the ATAGI advice, I just would like to also join my voice to the Minister for thanking ATAGI for their work over the last week and indeed right throughout this process. It is very difficult making decisions as evidence is coming forward on a daily or even hourly basis. It is 4 weeks today since we found out about Omicron, this new variant of concern, and in those 4 weeks we have already gained a lot of information, and in the recent days even more information, particularly around severity and what is the effectiveness of vaccination programs around the world. So why has this announcement been made? There's 2 reasons to bring forward the booster dosing. The first one is as has been mentioned by the Minister, as has always been our main aim of the program, is to protect those that are most at risk of severe disease. So they remain our priority. Protecting people against severe disease remains our priority. The information we know, and as I say, it's been emerging only over the last few weeks about the protection of the vaccine. We know two key things. One is that there is a diminished but not completely, the protection does not completely disappear in relation to severe disease from the first 2 doses of the vaccine. It wanes over time, hence the time-based change in the boosters. The positive effect of that is that we do know now that boosters do protect and increase that protection against severe disease once that 3rd dose is given, or a 4th dose in the case of immunocompromised people. So though that they are given, it's an absolute aim of the program to go forward and do that. But I will stress that just because you get to 3 months or 4 months or 5 months or 6 months, it doesn't mean that you immediately just that day lose your protection. That is not the case. It does decrease over time. It remains in place for severe infection, but it is diminished for Omicron compared with Delta. So that's the first point of the reason why we're bringing forward that booster program to 4 months from the 4th of January and 3 months later towards the end of January. The second reason is because boosters at this stage can help about the transmission of the virus, so the infection of people and with mostly mild or even asymptomatic disease, but they can then transmit it to other people. We know that, unfortunately, 2 doses does not change that ability to become infected a great deal. That, again, wanes over time, and there is a time-based process to that, but that protection against infection is diminished. Again, in Omicron, that's quite clear. Again, with a booster, it goes back towards the same levels as Delta. It will be an important, and is already becoming an important part of our control of the current Omicron wave in Australia. It is not enough by itself. The public health and social measures that have been introduced in many states in the last few days will assist with that as well. The personal protective elements that we all know so well. You would have noticed at the beginning of this press conference, both the Minister and I were wearing masks. I'm wearing a mask wherever I'm indoors in a public setting, and wherever I cannot guarantee to be socially distanced. So that is an important component, and we've seen that change in recent days. The final thing I would say, just to stress a couple of the small print details within the ATAGI advice, and this really goes to the heart of protecting the most vulnerable first. So we really do encourage people to come forward if they are in those well-known vulnerable groups for severe infection. People who are our elders in the population, Aboriginal and Torres Strait Islander people, those with chronic disease, those who are immunocompromised. You now can get that 4th dose. That will be your booster if you are eligible with that 4-month interval going to 3 months later in the month. And I just a real shout out to anyone who is pregnant or is planning to be pregnant. These vaccines are very safe in pregnancy. We know now very clearly that both the woman who is pregnant and their unborn child, they are both at risk from this virus, and vaccine does protect and is safe. So that is very important for anyone who has not yet had their primary dose schedule or are eligible for a booster. Please do not hesitate just because you are in those categories. Minister?
Thanks, Paul. Now I'll start with those in the room on the left-hand side front as you're looking out, if that's the right place.
Minister, can I ask, or actually Chief Medical Officer, can I ask you, for an Australian watching this, just simply, what has changed? So Targi's looked at this a few times in recent weeks. On a simple basis, what's changed? And then my next question, if it's every 3 months you have to get one, are we looking at 4 jabs a year for Australians going forward?
So firstly, what's changed, and I mentioned that we've only known about this virus for 4 weeks, but in the last week, in fact, last night and the night before, there was more evidence that came around the protective effect of boosters, but also that waning element. And so the best evidence they've got at the moment is for between 3 and 4 months, essentially. For the reasons of implementation, we've gone with the 4 months. They've advised on the 4 months to start. And as the Minister said, that's a large increase in the numbers that will be eligible, and going towards 3 months when that can be implemented. Throughout this vaccination schedule, there's a sense that everyone wants to be vaccinated on the first day an announcement is made. That is not necessary, and indeed it's not possible. We know that we have huge numbers of points of presence, around 10,000 places you can get a jab at the moment, and that is continuing. At National Cabinet, the PM announced the other day when we had our press conference that that the states and territories are doing their bit. They've committed to go back to peak clinic use. We have our GPs, our pharmacists, Aboriginal community-controlled organisations. They're all available. They will all be doing booster shots. They're already doing booster shots, and that will roll out as we go. In terms of what happens in the future, that's the future. Let's deal with this booster at the moment. This is specifically and particularly related to the changes from the Omicron variant, and we know, as I said, that one booster with the generic booster gives a good boost to protection both in infection and particularly and most importantly in severe disease. What happens in the future with future variants, if they come, that's a matter for the future, but we're certainly looking at that very closely.
Yeah, I'll just add something to that, and that is, of course, as Paul was saying, it's 4 weeks since we've been aware of the Omicron variant, and the world has learned a lot. Particularly the combination of effectively more transmissible but less severe, and that's an evolution that the epidemiologists have explained is not uncommon in relation to the course of a virus, and so we've adapted as we've had that information, and Australians have adapted. We were due on the 6-month time frame, which had been the international norm and ATAGI's recommendation prior to Omicron, to have had approximately 1.3 million vaccinations by now of people who were eligible. We're, as I say, at 2 million today. So we've been able to step up, bring more people forward. I said over 500,000 ahead of that schedule, well over 500,000 is the correct answer. And so, as we've done throughout the pandemic, a virus the likes of which the world hasn't seen since the Spanish flu, so for 100 years, we've been able to adapt. And we have, in my view, the best medical advisors in the world, the National Incident Centre, the Chief Medical Officer's team, ATAGI and others. They've done a magnificent job and they've just never stopped. So I want to give a particular thanks to them in a world of uncertain information. They've helped provide a guiding light and stability for the nation. I'll start front left, light blue shirt. Sorry, I'm blind as a bat without being in the...
Hi, Mr. Hunt. Professor, ATAGI says in their statement here that ATAGI expects the booster vaccination alone will not be sufficient to prevent a surge due to Omicron. I think everyone kind of knows that Omicron's around and it's going to be here. But surge numbers that are data reported, do you think that helps or scares people? You know, when they hear there's 5,000, when you go out, you hear that people are saying, 5,000 today in New South Wales, or when your number's there. Do you think that's helping people to get the booster, or is it kind of scaring people?
It's a good question. I think it's a bit of both. We've been saying, the Minister, myself, Prime Minister and others have been saying for quite some time, cases are not the most important thing at the moment. Most of those cases, the vast majority of those cases, are mild or asymptomatic. However, we have talked about transmission, and so what we're seeing in other parts of the world is a doubling rate of cases every 2 or 3 days, and that is what we're seeing here. We're not seeing that same sort of increase in hospitalisations or ICU, and I think they're the most important metrics for people to look at. People should be alert to this. Take it, particularly with this announcement today. Make that booking in the new year to get that booster if you are becoming eligible in the new year period. If you're eligible now, don't hesitate. Get it today. Yep. Sorry, go on, Pierre, Minister.
Sorry, no, that's a promotion.
Sorry.
I won't take it. Look, very briefly, in terms of ventilation, on the 15th of December, and I mentioned these figures yesterday, there were 54 Australians in hospital under ventilation with COVID. As of the figures from last night, the National Incident Centre has, there were 53 Australians in hospital with COVID. Now, that may change during the course of the morning, and that will change over coming weeks, but that's an important indication of the fact that whilst this is a more transmissible disease, it does appear to be less severe. And we're taking these precautions to add the extra protection for Australians and to help them stay ahead of the curve. And then going behind.
Professor Kelly, just on those dates, the 4th of January and the 31st of January, is that health advice or is that just the sheer logistical challenge, as in the system is not ready to bring forward the boosters yet? Can you sort of explain about why it's staggered in this way and why, people might be wondering, well, why can't I have it now?
So I think it's based on the science and the medical advice. We know that it is not an immediate thing when the vaccine starts to wear off. It's a time-based thing. And so again, as we've done all the way through the process, is we've prioritised the ones that are most at risk. Nowhere in the world has done, when we got to our peak of vaccination, we were around 2.2 million doses a week. That on a per capita basis was leading the world. That's what we aim to get to and achieve and to exceed during January. But at this time, and Minister has already mentioned the exhaustion of our health workforce, it is just not feasible to suddenly give those large numbers their doses during this period. Now, as I said, that they will be, the prioritisation is definitely for those that are most at risk, and so that will continue to be that. In terms of the advice, the ATAGI is the Australian Technical Advisory Group on Immunisation. They do and must take into account the programmatic and implementation elements of this. And they've discussed that with us. And then it's the government's job to be able to follow that advice, as we've done all throughout this pandemic, and will continue to do so and implement their advice.
And just one of those programmatic issues is the 5-year-olds to 11-year-olds coming online on the 10th of January. Is that why the 3-month is delayed to later in January?
Well, there's no change to that. Yeah, Minister.
No, I might add to we're intended to do two things. One is to ensure that we have the children's vaccines, and I think there would be no Australians that I hope would want us to delay or defer childhood vaccination. That's proceeding precisely according to schedule. The TGA is making great progress with their batch testing. We have the first doses that are in country that are going through those processes, and important tick-offs and milestones being achieved. The second thing is to ensure that the booster program continues, and of course there's a third element for those small numbers that haven't had first or second doses to deliver those. But what this does is it will mean that there are 7.5 million Australians who are eligible from the 4th of January. That includes those that will already have had eligibility, and by then we will have had well past the 2 million figure that will have been boosted, and so that gives them that immediate opportunity. And those are overwhelmingly older Australians or more immunocompromised Australians who have been less recently vaccinated. So, of course, there has to be a priority program. The alternative of suddenly putting an extra 4 million people who would displace the older or more immunocompromised and less recently vaccinated is absolutely at odds with the right way. I know there was somebody who mentioned this yesterday. That was, in my view, absolutely against the medical advice. And so it's all about following the medical advice and making sure that there's an orderly stage process. And then by the end of January, we will have approximately 16 million people who will be eligible, and eligibility commences the window for vaccination. Going to the back, please.
Professor, Just on the January timeframe bringing forward now, we're going to have some immunocompromised people who had their third shot in October or November, then become eligible. How do they go with, do they take a fourth shot, or do they wait for updated health advice in January? And then perhaps for the Minister, or I'm not sure if this is for you, Professor, how are we going to start measuring vaccination rates, giving the waning protection, when we hear premiers saying we don't need to bring in certain restrictions because we're above 90%? How do we update those rates if people, aren't boosted and their vaccination and protection have waned?
So a number of questions there. Firstly, just very specifically for those who are immunocompromised, they'll be due at that same time period after their third dose rather than their second dose. So their fourth dose will be if they're over 4 months on the 4th of January. There'll be very few in that category, but by the end of January they'll be due for their fourth dose, many of them. In terms of the reporting and so forth, well, we've had very open reporting about the first and second doses. I'll leave that to the Minister about what we might be doing in terms of reporting boosters, but we've said some of those figures today, and the latest I saw was we were at 57% already of the people that were eligible today have had their vaccine, and pleasingly that's a higher rate for those in the above the age of 70. Those higher risk people. Yep. Minister?
Look, Paul's absolutely correct. As of today, it's about 57.7% of eligible people who have had their boosters. As Professor Kelly says, that's a higher figure still amongst the older Australians. And so that's very heartening, knowing that many of them have only very recently, in the last 10 days, become eligible. So they've stepped forward, and some of them are only becoming eligible, yesterday or the day before. And at this point in time, I think yesterday, 90,000 more people were vaccinated than became eligible on that day. So 147,000 were vaccinated with boosters yesterday. And that was 90,000 more than were freshly eligible on that day. So each day, new people become eligible. The second thing is that we publish all the figures. I think on a daily basis, we publish approximately 700 different data points and make them available. In addition to that, there's another over 3,000 weekly data points. So you've got more than 700 data points a day, published daily, close to 5,000 a week, and then another 3,000 that are published weekly. So our approach has just been to provide that information, first doses, second doses, booster rates, state-based rates, age cohort rates, Indigenous, disability, aged care. All of these are done on a daily basis, and we'll continue to do that. Going across to the middle rear, please.
In terms of public health measures that are being introduced because of this fourth wave, looking at the data overseas, is it likely we're going to be living with these restrictions for most of 2022? And just secondly, with all these new people becoming eligible, the 16 million by the end of January and the 7.5 million by the 4th of January, do we have enough vaccines in the country right now?
Yes, so we have 20 million vaccines that are in the country now. More than 5 million that are in the field on the basis of orders. So we've provided to the states and territories, pharmacies and GPs, all of their orders. They're working on a high volume access, and if more is requested, we're happy to provide it. So one of the things we did, and some may have raised their eyes at the time, when we ordered 60 million Pfizer for 2022 and 15 million Moderna for 2022, we were anticipating that there may need to be a third and a fourth dose. There was no medical advice to that effect at that point in time, but we were anticipating that there may need to be a third and a fourth dose. And indeed, there's enough for, with those figures for 5 doses, and the Novavax, which is making its way through the TGA, and that's progressing well. And there's an extra 51 million doses of Novavax. So we're in a fortunate position with doses in country, doses in the field, and doses to come, whether a fourth or a fifth dose were required. We just provisioned on the absolute highest need, worst case scenario. Across to the right, please.
Oh, sorry, just on restrictions as well, living with restrictions into 2022, perhaps for you, Professor Kelly.
Thank you. So we've seen many waves around the world, and we know how they go. And they generally last for a month or two and then drop down again. That's pretty much a standard wave of this particular type of virus. I expect that's what we'll be seeing here in Australia. Very rapid rise in cases, as we've seen in the last couple of weeks. What that peak will actually be will very much depend on the two main weapons that we have, or three, the same as we've had all the way through. The booster program is part of that vaccination program. Get out and get your booster, get out and get your vaccination. That will help. Public health and social measures, they're a matter for the states, but there are general principles, and there's I think now a pretty close alignment across most of the states in relation to that, even Western Australia today with their mask mandate over the next few days. And the third one is test, trace, isolate and quarantine. We've been given specific instructions. I and AHPPC have been given instructions to come back to National Cabinet in the first week of January to look at what Omicron does in relation to what we can and should be doing in test, trace, isolate and quarantine. What is the role of rapid antigen tests, for example? What sort of things should we be taking into account in terms of our contact tracing when we have these large numbers? What should we be doing in terms of people staying at home if they are found to be positive or a close contact? Definitions of close contacts. These are all being looked at very rapidly now in the light of this new phenomenon.
Great. And on the right-hand side front, please.
Okay. Question probably for the Minister and then separate to the CMO. Minister, some pharmacists are still claiming they're having trouble getting access towards the end of the year for vaccines and being told to wait. Your advice to them, and also an update on the aged care booster rollout if possible. And then I might ask the CMO to reflect on his Queensland colleague's comments yesterday about the virus being necessary to spread as we move into the endemic phase of this emergency.
Sure. So firstly, with pharmacy, we've seen record numbers throughout the last 10 days. Yesterday, we had in our pharmacies across Australia 52,294 vaccinations. That's more than triple what it was just a couple of weeks ago. And last week, there was an increase of 497 pharmacies who were delivering boosters. So I'd seen some reports saying that there had been a decrease. Those statements were clearly categorically incorrect. And the number of pharmacies delivering boosters last week increased by 497 compared with the week prior to that. Today, we will pass 3 million doses delivered by our pharmacies, and we're seeing extra orders, and they're being met. And all up, we have over 3,000, I'll give you the exact number, over 3,400 pharmacies that are in the field and delivering vaccines. And what we're seeing is that this week there are over 11,000 deliveries of either vaccines or consumables coming from the Vaccine Operations Centre. So there are no constraints on numbers. On any one particular day, a particular pharmacy may have more demand than they previously expected, but we're able to meet that.
And on the aged care rollout?
Aged care, so as I said yesterday, we're approximately 300 facilities ahead of schedule. Over 1,500 have been vaccinated at this point in time, and we'll just continue to keep doing that. We'd urge those that are eligible to schedule as early as possible, but we're meeting all of the requests, and as we're approximately 300 facilities ahead of the schedule we'd anticipated. So I want to thank the facilities and thank the families for providing their support and consent.
And on the Queensland Chief Health Officer, I won't address those specifically. They're his views, but we do know that for endemicity, which means essentially living with COVID, there are two ways that we can that will happen in terms of people being gaining a protection against future disease. That's either getting the disease or being vaccinated. I know which one I would choose. I have chosen. I've had my booster, so has the Minister. So that does give that extra level of protection and does protect you against at least severe disease. But it is inevitable in this wave that there will be many people that also get infected. The reason is because, unfortunately, past infection does not give or indeed where those things have become compulsory, please follow that, not because they're compulsory, but because that's the right thing to do. And finally, for boosters or primary courses, do not hesitate, make that vaccination appointment. There is plenty of vaccines in the system to do so.
Great. And then last question on the right-hand side at the back, please.
Minister, we've heard the states, on advice from their own health officials, calling openly for days for ATAGI to shorten the interval, and seen repeated denials from yourself and ATAGI to do so. Minister, why the change of heart?
Look, with great respect, that's incorrect. What we've seen is that ATAGI has already moved on the basis of international evidence from 6 months to 5 months, and that's seen a rapid increase in the uptake of boosters. And what they've done is, again, continuously review the international evidence, and off the basis of the international evidence, they've followed it. One of the things that's been a hallmark of Australia's approach to the vaccination program is listening to the medical advice, and we're blessed in this country and with the quality of medical advice that we've received. And to finish, as we lead into Christmas, I want to give this message. That is a message of thanks to Australians for coming forward to be vaccinated, for keeping distance, for doing the difficult things that are so contrary to our nature but so fundamental to our success. That's what has allowed us to have one of the highest vaccination rates in the world, one of the lowest rates of loss of life, and we've seen over 870,000 cases in the 24 hours to reporting yesterday midday globally, just to put it in perspective, and at the same time one of the strongest economic recoveries. So with all of those things, Australians have done extraordinarily well, and the key to it has been following that medical advice. And as part of that, I want to finish by thanking all of our doctors and nurses, our pathology collectors, our testers, those people who are administering the vaccinations, those people who are running the vaccination program. General Fruin and his team at Operation COVID Shield, Brendan Murphy and Penny Shakespeare at the department, Professor Kelly and his extraordinary team with Professor Michael Kidd and Dr. Sonia Bennett and Dr. Ruth Vine and Professor Alison McMillan. These are extraordinary Australians who've helped keep us safe. So these are challenging times, but we've got through it better than almost anybody. We'll continue to get through it better than almost anybody. And what has set Australians apart is their support for each other and the quality of the medical advice and the commitment we have to following that medical advice and working with our medical advisors. So I want to thank everybody, wish them all the best, and know that by having a partnership between the Australian public to protect each other and to protect themselves and the medical community, will continue to keep Australians safe. Take care, everyone, and have a great Christmas.